So we're now going to hear from Jenn Coffey, a leader with Rights and Democracy and the Care Over Cost campaign, who I've also had the honor of being on the front lines with. Jenn.
Good afternoon. My name is Jenn Coffey, and I'm a member leader with People's Action and Rights and Democracy New Hampshire. Like many, I worked my entire life, and I started paying taxes at the age of 15. I never anticipated breast cancer would end my 20-year career in medicine. I ended up with a rare disease from my breast cancer treatment, and it's pretty painful. It made me disabled. Life on Social Security disability insurance is a struggle to balance the bills and cover the ever-increasing costs of medical care, medications, all that my so-called health insurance refuses to cover. I'm on a privatized Medicare Advantage plan through United Health that routinely denies my claims. Then there are the little things, like eating. Never mind eating healthy at today's prices. My grocery bills have gone up $50 in the last couple of months. I know the corporations haven't lost a step in their profits. These things are being made worse by grotesque greed and corporate loopholes that enable billionaires to avoid paying their fair share in taxes, while they themselves reap the profits off of the sick and the dying. Costs are so bad now, I don't know many people who aren't co-living or even thinking about buying a house. They're worried about paying next month's rent. During COVID, my rent went up. All of a sudden, $400. Like a lot of people, we were 2 months away from being homeless when we figured out how to pull it off. I started rationing my treatments. At the same time, utility costs went through the roof, and yet the CEOs banked millions in profit and plenty to fuel their Gulfstream jets. While I rationed my treatments, the CEO of United Healthcare collected over $25 million in just 1 year. That money comes from our Medicare trust fund. They intentionally divert the money to their pockets rather than improving my life-saving care. Companies like United treat people as nothing more than commodities or liabilities, I should say. Now so does the federal government. I'm a liability to both. So I expect continued harassment, denials of care, forcing me to run a maze just to get the care that I not only need, but damn it, I earned this. I worked my ass off. I paid my taxes, but I didn't hire a lawyer or a lobbyist to avoid paying taxes like the billionaires. I volunteered. I lived a decent life. I paid in my share, knowing that what I was paying into was an insurance policy. Now, some like to call that an entitlement or welfare. How demoralizing if I allow it to get to me. I earned my benefits and I paid my dues. Now that's not good enough. Now they want to take that too. Since I can't make them money or serve them, I serve no purpose, right? I have no value, according to Kennedy. And Oz says I should prove my worth. Not only are the richest people in the country getting bigger tax cuts, they are stealing the money the working class pay in, expecting us to also pay for the $5 trillion it is adding to our national debt. Our country is redlining, and it is up to us to take back the country before it's too late. Thank you.
Thank you, Jenn, for sharing your experiences. It always makes me so angry to hear about this ongoing fight with United Health, but I have faith that together we can continue to push back and make some changes. Igor, back to you.
Yeah, thank you, Sandra. Thank you, Jenn. Thank you, Raquel. Thank you for sharing those incredibly powerful personal stories. I know it's not easy, but I also know that these are the stories, these are the experiences that are going to change the national conversation, going to bring us to a better place.